honor to be here today to speak to you. I come here from New Jersey in the United States to talk about our experience with super specialty reconstructive surgery. We have a private institute 1 hour south of New York City, and for the last 10 or 15 years we've developed a national and transnational medical tourism program for super specialty reconstructive surgery. We're based 1 hour south of New York City, so it's a hub with easy access from multiple international and national airports. Our physicians we've accumulated physicians from many of the top centers, academic centers throughout the U.S., and we perform comprehensive cosmetic and reconstructive surgery. Primarily our travel care is for the super specialty care that's not sometimes even available in the larger academic centers throughout the U.S. We're highly regarded in the U.S. and beyond as a super specialty center for the treatment of paralysis and peripheral nerve surgery. So our philosophy is compassionate patient care, commitment to surgical precision and expertise, super specialization and surgical advances, and a big priority is clinical research. We offer all cosmetic and reconstructive plastic surgery services that would be offered in other places in the U.S. and abroad. However, for some of our peripheral nerve procedures, we are one of very few that offer the treatments, and in some cases the only in the U.S. and abroad that offer these treatments. So basically, a head-to-toe treatment center for various peripheral nerve disorders. Peripheral nerve surgery is our super specialty. We also offer treatments for patients with spinal cord injury. Obviously not a cure, but a method to reverse certain problems associated with spinal cord injury using peripheral nerve surgery, such things as ventilator dependency, pressure sores to restore sensation, to prevent the pressure sores, hand paralysis, and bladder control. Our center performs thousands of cosmetic and reconstructive procedures, and every year we perform at least 300 or more super specialty peripheral nerve surgeries. 80% of it's within the U.S., 5% and growing would be transnational. We also make it a point to not just promote the surgery, but to promote scientifically to physicians in the medical community these advances through publications in the medical literature. A couple of the highlighted ones are the second institution globally to do nerve transplantation, our largest worldwide experience to treat breathing muscle paralysis using nerve surgery, and also the largest experience in nerve surgery and electrical stimulators to reverse ventilator dependency in spinal cord injury. We also just released the first of its kind textbook on this new super specialty or new specialty called rehabilitative surgery, basically a surgical treatment for patients with paralysis and other types of nerve disorders and peripheral nerve disorders. We've gained some notoriety within the U.S. for some of our groundbreaking treatments and for particularly patients with spinal cord injury. We partner up with many leading institutions within the U.S. As we are a private institution, and so having the academic affiliations has helped us grow, both on the East Coast of the U.S. and in other parts of the U.S. We practice primarily in New Jersey, but also perform surgery in California and Los Angeles at UCLA Medical Center for patients that are located on the other side of the U.S. We're also looking and seeking affiliations with partners outside of the U.S. as we grow our international portion of our practice. As has already been mentioned here, there are certain keys to success when developing medical tourism, whether it be on an institutional level or on our level, which is a private super specialty group. And obviously, it has to start with education and direct contact with the patients through telemedicine. We use virtual consultation every week to speak to patients that contact us to determine if they are candidates. We obviously have a department for coordinating travel and accommodations, dealing with healthcare authorization. We're very good at dealing with medical visas and having patients from outside the U.S. successfully travel to see us. Obviously, providing the services necessary when patients travel with their families for cultural and religious options, and then following the surgery, having a network or an outreach program that the patients feel as though they still are connected and that we're following them until they're fully recovered. So we make it a point to return inquiries within 24 hours. We do virtual consults, as I mentioned, and then we often will speak with the home physicians to get more information. We have patient coordinators that arrange the entirety of the travel plans, accommodation, visas, and insurance authorization to make it as easy as possible for the patients. As we know, especially for transnational patients, it's very stressful at the prospect of flying a long distance and being away from home for a period of time. We have staff that's very experienced with this international and government-issued health care. We work with all insurances willing to contract, and then if it's a cost issue, then we delineate all costs up front. We have concierge services, so whether it's an economical, whether patients on a tight budget or somebody that wants the 5-star service, we're able to offer that. Some patients will stay in New York City and travel to see us for the surgery, and we can accommodate patients with different cultural and religious varieties. Obviously, the epitome of a surgical center of excellence is surgical precision and outcomes. We pride ourselves on being innovators, particularly in paralysis and peripheral nerve treatment, and also providing the medical evidence to support that, to also speak to forums with physicians in various parts of the world to discuss the treatments we're offering, and then this new textbook that is sort of a comprehensive edition or a comprehensive volume of the different treatments we offer. We put a major emphasis on follow-up care. We want the patient to feel as though that we are with them as they are recovering anywhere in the world, and so we do virtual follow-up appointments, and we have nurse practitioners and ancillary staff to help with that. Our treatment philosophy is to find solutions for problems where there are none. So when patients are told there's nothing that can be done, we want to find something that can be done. We'll talk about just two of the many things we do with the last few minutes. One being nerve reconstruction for breathing muscle paralysis, and the other nerve decompression for a type of post-traumatic headache. This slide didn't come out very well. The first is for breathing muscle paralysis, which is the diaphragm muscle, which controls breathing. When patients have a problem with their diaphragm, on this x-ray, the diaphragm is elevated on one side, the lung isn't working, and the patient has a respiratory problem. Patients are debilitated, their quality of life suffers, they're prone to respiratory infection and other types of associated breathing problems. Until recently, the treatments have been limited. We started offering this pioneering treatment in 2007. To date, we've treated more than 350 patients from almost every state in the US and several other countries. We have 7 peer-reviewed articles demonstrating 89% improvement, and right now we are the only center offering this with any regularity. It is covered by most insurance carriers. The other treatment, just to spotlight, is called occipital neuralgia, often associated with a post-traumatic headache. And it's a condition for which medical therapy can be effective, but often there's a problem where heavy medications result in side effects and a lack of tolerance to those medications, and patients are often looking for alternatives. It often happens after a head injury. And eventually what happens is the inflammation leads to scarring around the peripheral nerves. There are so-called trigger points that are associated with these headaches that help us diagnose the problem, and the nerves in the back of the head are just part of the problem that we need to deal with. Obviously, there's medical therapy, injectable therapy. Botox is now a recognized therapy. But nerve decompression surgery is also an option that has recently been gaining interest, and there are maybe 25 to 30 surgeons in the U.S. performing this. We've had about 10 years experience, and we've presented this at some of the larger headache society meetings. So our present and future goals: we want to increase international presence for these super specialty treatments, expand affiliations with other premier healthcare facilities, and to promote surgical excellence through circulation of evidence-based reports and our recently released textbook. We also have a world-renowned rock band of all doctors. Thank you.